These are exercises that can be done every hour. You should be done every hour that you're awake when you're in the hospital, and then 1 to 2 weeks once you leave the hospital. So the first one is breathing 10 times. Breathe in through your nose and out through your mouth. A long exhale, blowing the air out. And then the next is 10 incentive spirometer and the VibraPep. Those are the two breathing devices that should have been given to you at the hospital. These can be done just within the hour. You don't have to hold the device and do 10 in a row, but just make sure to get 10 every hour. And then 2 coughs. Breathe in through your nose, hold the air for a second, and then a big cough, squeezing your belly muscles and holding that pillow tight to your chest. And then 20 ankle pumps, which is moving the feet up and down. You're going to see these exercises in the next few videos. So this exercise, it's relaxed breathing. So you're just breathing in through your nose and a long exhale out. So it looks like this. So we like to tell our patients, pretend like you're blowing out a bunch of candles on a birthday cake. So some deep breathing exercises. So breathing in through your nose, hold for a second, and blow out through your mouth. Nice and easy. Get all the air out and breathe in through your nose and out through your mouth. Okay. In through your nose, make the tissue fly. Make it fly, 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 fly. Good. One more. Okay. Another breathing is going to be the same way you're doing it, but put your hand on your tummy. This is going to be pushing up on the diaphragm, the main breathing muscle. So in through your nose, and as you exhale, push. So it should come, your hand should come out, and push in. Good. One more. Okay. Next one, lateral costal breathing. So breathe in through your nose, expand the ribs, expand the lungs, and push in. Push out. Push in, blow it all out, blow it all out. Good. Okay, so this is an incentive spirometer. So in your procedure, what they have to do is deflate your left lung. They reinflate it, but not to 100%. So this is going to help maximize the capacity of your lungs. So what you do is breathe in through your nose, blow all the air out your mouth, and then put your mouth on, and you want to keep it in between good and better. Good. And then let it all come out. Take another breath. Take a breath. Good. So what you're focusing on is this one. Don't worry about this number. Let it go all the way down. Take a breath and then suck in. Good. So this is called the VibraPep. Following your surgery, there's going to be mucus in your lungs, and it's important to get the mucus out to prevent bacteria from getting stuck in your lung infection. So what this does is it loosens up the mucus inside of your lungs. You're going to loosen it up in the lower part of the lungs, and it'll start to bring it up to the lungs, out, and then hopefully you can produce some sputum to get it out. So breathe in through your nose, and a long exhale out. Good. Another breath in through the nose and out. That's 2. Long. Good. So the next thing I'm going to show you is coughing. So at the hospital, they probably gave you a heart pillow, but I just have this one, so it'll have to do for now. So you're going to bring the pillow up to your chest, cross your arms, and squeeze the pillow tight. You're going to take a breath in through your nose, hold it for a second, and then let out a big cough. When you let out the cough, your elbows are going to come up as you breathe in, and then down, squeezing the pillow tight as you let out the cough. So it looks like this. So if your incision was made between your ribs, you're going to do a little different splinted coughing. You're going to bring the pillow here. Left arm's going to come around the pillow. The right arm comes around this way. And it's the same thing. Breathe in through your nose, hold for a second, and a big cough. So it looks like this. Okay. So for doing steps at home, you have a family member with you, a friend, whoever, they stand behind you when you're going up the steps. So Brad here is going to take 3 steps up, and I'll show you where you should stand. And if he were to lose balance, I would push him forward and don't let him fall backwards onto me. So you can go ahead, Brad. So as he goes up, I go up. Just making sure he's okay. Good. And then for coming down, turn around, Brad. I'm going to stand in front of him. Again, if he were to fall down, I want to push him down on the step behind. So you can come down, Brad. Just like that. Good.
This exercise is called ankle pumps. These are a great exercise to get the blood flowing and the muscles working before we sit up and even stand. So what we're going to do is you're going to be lying on your back, and you're going to think about pulling your toes up towards your chest and then pushing your foot down like you're pushing on the gas. Toes up towards the chest, down towards the gas pedal. And we're going to do this 20 times on each leg. The next exercise is called heel slides. What you're going to do is while lying in bed on your back, you're going to bend your knee and hip up towards your chest while your heel or your foot slides along the surface of the bed. You're going to bring your knee as far as you can up towards your chest, hold it for 2 seconds, then push that leg straight out to be flat on the bed. Then you're going to bend that knee and hip back up towards your chest, letting that heel slide, and then back down. We're going to do 20 on the left leg and 20 on the right. The next exercise is called hip abduction and adduction. What you're going to do is while lying on your back in bed, you're going to start with your right leg. It's going to be straight with the toes pointed towards the ceiling. You're going to keep that leg straight, and you're going to move it out to the side and then pull it back in, keeping that leg straight the whole time. You're going to pull it out to the side and bring it back in. We're going to do this 20 times on the right leg and then 20 times on the left leg.
This exercise is called a straight leg raise. You can do it lying down flat or sitting up in a recliner with your legs up. You're going to just raise one leg up about 45 to 60 degrees if you can, or as high as you're able to do it, and back down, making sure you touch your heel down every time. And again, just go as high as you can go. The idea is to activate those muscles above the knee, and it's a good exercise for strengthening quadricep muscles.
The last exercise we're going to do lying in bed is called a short arc quad. You're going to take a pillow, roll it up, and place it underneath your knee. After the pillow is placed underneath your knee, you're going to kick your leg so your toes are going up towards the ceiling while keeping your knee on the pillow. And then you're going to slowly bring that foot back down. You're going to kick that foot up, hold for 2 seconds, and then bring the heel back down towards the bed. We're going to do 20 repetitions on the right and then 20 repetitions on the left.
This next exercise is called a full arc quad, seated leg kicks you may hear. So it's going to be straightening your knee completely out in front of you and back down, just doing one leg at a time. Going to do 20 reps out of this. A lot of people will tend to not straighten their leg fully. You want to make sure that it's coming completely straight when you kick it up. Counting out loud as you're doing these to help your breathing. You're not picking up your knee. Notice the knee is staying where it is. It's just kicking the leg straight out. This next exercise is called seated marches. You can do one leg at a time as being shown here, or you can do alternating legs, going one and down and then the other up and down, alternating. You notice picking the knee up, picking the foot up off the ground as high as you can. If you're not able to go this high, that's okay. Just pick your foot up and the foot comes in contact with the ground after every rep. Try not to lean backwards or to the side. Just want to sit nice and straight up and down.
Anthony for three.
Yeah!
Oh, no reaching hands over your head. Tickle, tickle. Whoa, no retracting your shoulder blades back. No pulling more than 8 pounds.
Hey, man!
Whoa, no pushing more than 8 pounds. This is the walking program. It should be started at level 1 the first day after your surgery. So it's going to be a 5-minute walk, and you're going to do that 5 times throughout the day. So we usually tell patients to do 2 walks before lunch, 1 right after lunch, and then 2 in the afternoon. So once you're able to do a 5-minute walk 5 times per day, you progress to level 2, where you do a 7-minute walk this time 5 times per day, and so on. And once you get to level 6, it's a 15-minute walk, but only 3 times per day. The walking program continued is, again, increasing the minutes each level. So once you hit level 9, it's a 23-minute walk and only twice per day, all the way till you get to level 12, where you're able to do a 30-minute walk 2 times per day. And then once you're able to complete that, it's time for cardiac rehab. can talk to your physician to get more information. Usually you're given information at the hospital about setting up cardiac rehab. Right when you wake up, you're going to take your heart rate, and that's going to be the number you use as your resting heart rate. And as you exercise, you're going to reach a certain number where you're going to want to stop, take a rest, take some nice deep breaths in through your nose and out through your mouth, like shown earlier in the video. So I have an example of how to calculate it. So say you wake up in the morning and your heart rate is 65. You're going to multiply 65 by 0.2, and that's going to equal 13 beats per minute. And then you're going to add that 13 to your resting heart rate, which was 65, so 78 beats per minute. So you're going to walk and monitor your heart rate. You can do this with Apple Watch, a Fitbit, or you can buy a pulse ox off of Amazon. And once you hit 78 beats per minute, you should stop and rest. And in the columns here, I just showed a general idea of what your resting heart rate is and then where you would stop and rest once you reached that heart rate. So the next thing we're going to do is stand up and go for a walk. So it's a good idea to monitor your heart rate for sure. That's probably the best one that you want to look at. And then your SpO2 level is also good to look at. You can get a pulse ox on Amazon, usually for pretty cheap, or the Apple Watches and the Fitbits. They can monitor your heart rate, and those will be good too. So I'm going to put this on your finger. Keep track of your numbers while you're walking. So when you stand up, you're going to put both hands on your knees, bend your nose over your toes, lean forward, and stand up. So you can go ahead and do that. And I'm going to time you. We're going to start with a 3-minute walk is our goal. Okay? All right, so let's go. So you're going to take your heart rate in the morning, and that's going to be your resting heart rate. And then you're going to take 20% of that heart rate that you get in the morning and add it to your resting heart rate. And that's the heart rate that you don't want to exceed when you're walking. If you reach that heart rate, then just take a break, sit down, and rest. And then your heart rate should come down. If it's still going up, then you might need to seek medical attention. Okay? But right now you're doing good. Your oxygen levels are good. You're maintaining a stable heart rate. You got a minute down. So other things to look for. So you're looking at your heart rate and your oxygen. And even if your numbers are fine, you still might feel short of breath. If that happens, you can stop and take a rest and just do some of the breathing in through your nose and out through your mouth, just like what I showed you earlier today. Okay. So how are you doing right now? You doing okay? Feel good? All right, we're halfway there. So just swing your arms. It's not about the distance that you go, it's about more time. So if you need to slow down your pace, that's fine with me. So you don't fatigue out too quickly. Keep your head up, good. Make a left here. All right, 40 more seconds. Still doing okay? Doing all right? All right. So we'll make a left here again. And so there's this other thing called a 5-meter walk test. And so every 16 steps, you mark down how much time that is. So if you're between 9 and 11 seconds, that's right where you want to be. If you're up and you're like 18 to 20 seconds, that means you're pretty deconditioned and you might need supervision from a physical therapist or some other exercise physiologist or cardiac rehab to monitor your vitals while you're exercising. Okay, and you've reached 3 minutes, so that's good. So we can stop now.